Good afternoon, distinguished participants. I am so excited to be here today, and I welcome you all to this so far very educative and inspiring Maiden Summit in pharmaceutical compounding in Nigeria with the theme Compounding, Pharmacy Compounding in Africa, Shaping the Future for Nigeria. I didn't know I would have the responsibility to do this other one. So I welcome you all to this panel discussion, which I'm sure will be very engaging. I am really excited and encouraged that since morning, the hall has been filled and nobody leaving. So I will try my best to make sure that we keep the tempo. We are mostly honored to have you at this landmark section, which we actually set the tone for a new era of pharmacy compounding in Nigeria. It will lead to the evolution. We know we are doing some compounding today, but we want to scale it up and move it to the next level. So your participation and deliberation today are vital in fostering stronger ties among our various colleagues, pharmacists here in Nigeria. And also I see it as opening doors for some international collaborations for shared professional advancement and economic prosperity. Much has been said about definition of compounding and those that needs it. So I won't want to belabor you on that, except for those that came late. So, but we all know that compounding is the bedrock of pharmacy. And that was highlighted by the professional iconic symbol of the pestle and mortar. While in school, we could recall that most of us, we spent several hours in the lab compounding, titrating, calculating parameters. But as soon as we get out of school, it's like we just kind of forget it. And for some of us that worked and are still working in the retail and the pharmacy, hospital pharmacy, if we do at all, is to the minimal. And globally, compounding has been seen to be a very vital part of successful healthcare delivery, although Nigeria is still being underestimated in that area. So we hopefully believe that going forward, we should think deep and see what we can do to make it better and join the train of the global excellence. So we study so much in school, and then once we come out, we forget most of those. And that made me always refer to us as overtrained pharmacists, but highly underutilized. I don't know if you agree with me on that. Yeah. So today, the panel discussion is designed to foster insights, dialogue, highlight diverse perspectives, and inspire us to become active contributors to a potential compounding ecosystem that expands the boundaries of the pharmacy profession in Nigeria. On that note, I welcome my expert panelists to this section and believe that we have a good number of hands to do justice to the title of the day, the prospects, challenges, and regulatory pathways for pharmacy compounding in Nigeria. So my first question goes to Professor Jennifer Audu Peter. And the question is, from the academic and policy standpoint, how do you see the role of pharmacy compounding evolving in Nigeria's healthcare system over the next decade? And what are the most pressing regulatory or policy gaps that need to be addressed to make compounding sustainable in Nigeria?
First of all, I want to look at the educational sector and how it has been set up to prepare pharmacists for their compounding role in the society. And as you know, we run our curriculum based on NUC. NUC has given us curriculum to run at the university level. And as recent as I think 2023, we now have a new curriculum of which they say 70%. They've given us 70% of the curriculum, while the universities are allowed to incorporate 30% of what they call innovative courses. Okay, that is peculiar to their training. So, as such, the universities are positioned to implement compounding and to incorporate if they feel that the CC mass has not captured their need using the 30% window. So, the CCMAS has provision, as I said, emphasizing core courses that talk about compounding, pharmaceutics, and pharmaceutical technology. But when I go for accreditation, I'm one my panel on NUC accreditation across schools of pharmacy. What I see, even before the CCMAS was implemented, is that the curriculum for compounding is not uniformly applied across the universities. And as such, you find out that whilst, especially with the new FAMD, which to my mind has been misapplied in the schools of pharmacy that have gone for accreditation, because what you see is a lot of emphasis on clinical studies. And I remember when I was doing my West Africa postgraduate college, I chose drug production and quality assurance as my faculty. But that part one, it was virtually clinical pharmacy. So we'll be quarreling with them. I told them, I'm not here for clinical pharmacy. I'm here for drug production. So FAMD, and I want to inform I think the other person that talked about their design. Yes, you tried as much as possible to make it superior to the FAMD of other people, because like India, for example, they are beginning to regret implementing FAMD. Maybe because they totally, they took everything, the curriculum, and applied it to their system. And now they are having problem because they do not have people that can, they can, employ to their production sector. So as such, the curriculum that we are running now for FAMD is there's I don't know, they say they don't want product oriented. So I'm happy that when we talk about compounding, we are talking about a patient-centered pharmaceutical care, because each patient will have a drug designed for his or her own issues. And that's what we have noticed about the curriculum. I also want to say that for the PCN, for example, they can help us to strengthen the curriculum by incorporating, those regulatory issues that we want to see. If you can capture it in the PCN also go on accreditation, and that if you begin to ask for those compounding regulatory issues, compounding across schools of pharmacy, okay, perhaps that will strengthen compounding, so that, because when I listen to some of the questions that are coming up, I can tell you which of the schools of pharmacy are weak in compounding and which are strong in compounding. So when you are going, or maybe you need to revise your regulatory this thing. We are waiting for. That's one of the things I've written, that I wish PCN we now sit down, and I'm happy to note that PCN has been training, as it were, educating, and reaching out, and even trying to get from other areas that they have very strong compounding, like South Africa, so that you can be able to develop regulatory policies along that line that will strengthen schools of pharmacy, so that it will be easier.
Thank you for setting that foundation. So, from your speech, we've heard that there's established curriculum in the university, which enables the university to carry out compounding, and you are seeking the collaboration of PCN to put up some regulatory guidelines or frameworks to guide the university to strengthen compounding in the university. And I'm glad that the PCN registrar is still here. Please, I hope you are taking notes. Again, I got from your speech that the university already looking at specific patient care design for drugs, which is good. So I would like to move to the next list in the Dr. Margaret Ilomwanya. My question to you, ma'am, is as a researcher and an innovator in drug development and cosmeceuticals, what unique opportunities does compounding present for innovation in Nigeria? And how does this support specialized patient needs, such as wound care, dermatology, and personalized therapies?
I think that's very exciting, especially for those of us in academia. And I will just share a short story. I don't know, for those of us that know Professor Odukoya in pharmacognosy, she came into my office about, I think this was about a decade ago, and then she was like, Margaret, if anybody comes here to collect cream again and you're not charging them, I will beat you in this faculty. And then she left and she banged my door. I always used to make creams, and then colleagues will come and they will use. And it was after that, I got thinking, and I walked to the dermatology department and then asked them what that's dermatology department in Louth, asked them what they needed. And it was amazing what the opportunities that were available. So personalized medicine is an important opportunity for innovation because you're able to tailor it to individual patient needs. And what that did, in fact, one of the excellent advice I got from our dermatology department was, look, you may not be able to interface with the patient, so why don't you interface with people that are seeing the patients? So one of my biggest clients is actually a community pharmacy that compounds. So we develop formulas for them and we charge them and they pay. And it's good money.
Wow.
Yes, I say it openly. And these community pharmacies come back to us. So we develop compounding formulas. So then the next aspect that I think one of the things that was really significant in the work we do was traditional medicine integration. We've had traditional medicine practitioners that come to our laboratory with herbs and pay us to compound for them. Sometimes we have so many things to compound, we turn them back and they pay. So traditional medicine integration is a huge opportunity for innovation. And there's a lot of research that is already being done by our students. So it would be very good if we can integrate these traditional remedies with modern medicine. And then, have it mainstream, not just as complementary therapies, but as actual therapies as well. And then, of course, we look at dermatology, skincare. The skincare craze is, somebody said it's crazy. Thank you. So that's another opportunity for innovation. Working with the dermatology clinics, my team has been able to develop cheaper vitamin C serums for people. Yes, for vitamin. So it's a bed for innovation. So so when it comes to dermatology and skincare, at the community pharmacy level, because it's at the community pharmacy level that we see people with facial burns and things. So at that point, they can begin to innovate products that can help relieve those things. Of course, working with the dermatologist. I think I should actually emphasize that. Then the next thing is, your second question was, how can compounding support specialized patient needs? Wound care is an issue. I don't know, for those of us in the hospital, how many of us have access to, is it hydrogenous creams for wound care? How much is it? is very expensive. It's very expensive. These are things that can be easily compounded because it will promote wound healing, reduce scarring, and prevent infection, especially when you're using clean products. There are companies in Nigeria that have clean shea butter. There are quite a number of companies that have clean shea butter, and there's one of those companies that we actually patronize when we want to develop compounded medications for people with wound healing. So supporting specialized patient needs, wound care is a critical area. We've already talked about dermatology. If we look at acne, psoriasis, and eczema, these are the three leading conditions that make people spend so much money, and these specialty areas can benefit from compounded medicines. And then if we also look at personalized therapies, like, HRT has been mentioned earlier, these are also areas that would benefit from compounding. And then, of course, translating research findings into practical services. This is the way to go because there is so much research that is available in Nigeria. And one of the things that the Indian government does is to mine Nigerian research. They have an office. They have an office that the only work the office does is to look at the work that is published in Nigerian journals on herbal medicines. And then they reach out to those of us in academia to develop some of these solutions and pay us pittance. So if we look inwards and now turn that into, funding, that would be good.
Toilo Mwanya for sharing their perspectives on the topic from the research points. I have a lot of takeaway from your speech. Some of them are first that we need infrastructural development. We need to maximize the opportunity that we have locally rather than selling it out to international bodies. Then there must be inter-sectors and inter-ministry collaboration so that we all work hand in hand to make it happen. And then that the Q&A does not mean to be so sophisticated, but mainly on the human infrastructure based on trainings and retraining and then documentation. And then the need to commercialize the formulation for the personalized medication. Of course, I don't need to be told that you must be a commercial interesting person. So it's written all over you. So thank you very much. I will now move to Dr. Ngozi Udem to share her perspectives and insights from the hospital pharmacy side. So from your experience, ma'am, what practical challenges do pharmacists face in setting up and running compounding units? And then how does the compounding help to bridge the treatment gaps when commercial medicine don't meet specific patient needs?
Most people don't know that compounding exists in Nigeria. Now, in 2011, I was opportunity to go for training, and I came back, made a proposal how to start the compounding in USDA. It was just dropped under the desk. However, in 2019, an erudite, passionate head of pharmacy came up in the person of pharmacist Adora Simonye and saying, Ngozi, I heard you went for a training in compounding. Write a proposal. I'll push it. Immediately, I wrote it. He took it to a CMD. He approved it. Before this time, we had premise. We had some equipment like weighing balance, mortar and pestle, but we didn't have the raw materials and political will to produce things, especially for our pediatrics in newborn. So immediately I put it down. Money was released. We were able to buy extemporaneous booklet for preparing products for our pediatrics and geriatric, and then other raw materials like sherry. But the sherry was expensive. But because I had this knowledge of formulation science, we'll buy sherry from US, it will expire on us. I had to prepare simple amaranth syrup to prepare various cardiology syrup or seizure syrup, okay, for our children, or chlorhydrate syrup for anesthesia for ophthalmic patients. And anytime we prepare the syrup, it goes off because it's now cheaper. You know? So compounding came into play that whenever a baby is going for any procedure, they say, please go to compounding and get us that their magic syrup that will make baby to sleep, and they'll carry their procedure. So compounding has come to help a lot of that for pediatrician carry out of procedure on children, either eye surgery or doing ECG or echo for children. They don't think about making baby to sleep. They just come for it and give them that chlorohydrate syrup and they will sleep. Now, apart from that, if this political will not come in, there will be no compounding in UNJ, whether you have a good personnel or not. So some other people have heard about compounding is doing very well in UNTH. They approach me to write proposal and they present it to their HOD. She threw it somewhere. Then sometimes she will bold enough or he to present the case to CMD and say you want to make which one is compounding. They will not look at it. So, sir, we are saying that apart from talking about compounding, the Federal Ministry of Health, under PCN, should supposed to make it imperative that every CMD should ensure that the compounding pharmacy runs. If not, we can speak grammar here. Hospital compounding pharmacies will not exist. Number one again is that if they agree, would they release funds? After the approval, pharmacists went just wrote for huge sum of money to start that compounding, and it was released to her, and it was like an impress. It's not that they give you and you go. No, it is a impress that runs every month. I was giving 2 million, a million to start, but now 2 million every month to be reimbursed. So once you have a political will, it will back you out with the what? Finance. So that we run out of stock of raw materials. Okay? This is one of the things that happens. When you have the political will, you release the funds to get those material. Now, there's a very important thing, apart from personnel we are talking about. We're talking about the product raw material. It is a very huge challenge. We have heard about the doctors that come to us say, I heard you do this, you do that. Can you prepare for me? I will check, I will see the raw material, I'll write formula. But when I look at for the raw materials, I will not say it. I will approach some people, I'll get it. I will approach some other vendors, I will not get it. I just, sir, I'm handicapped, I cannot continue. Though I have the formula, but I have no raw materials to run it. So apart from that raw materials, we talk about quality raw materials. I've talked about accessibility. Some people can use a raw material that is carcinogenic and affect the health of people. So it's a challenge too. Apart from raw materials, what of the premises? I know very well. If you don't run compounding pharmacy well, in cleanliness, in monitoring of temperature and humidity, you are bound to have a faulty product. Because remember, temperature affects the stability of these products. So you have a daily taking of the temperature and humidity well documented. Apart from that also, your pharmacist himself should be part of the cleaning, both the wall, the table, and the floor. And every week, there will be a microbiology test of the sink and the table to ensure there is no microbiology on that, so that you won't have contamination. When you have news that some products have contamination, that means that pharmacy outlets, table surfaces, or people working did not dress properly, and there was contamination. But if there's a regular monitoring of the cleaning of the table, of the wall, of the personnel that's dressed properly, there will be no contamination. For more than 10 years now, I've not had contamination of any syrup or cream.
I've heard you with a lot of disclosure concerning disclosure, which I must say needs to be followed up, especially in the scarcity of the raw materials and also in the contaminants in the water we have, so that we make sure that when people are doing compounding, it's safe for consumption and not to cause havoc. Thank you so much. So we want to quickly move on to the retail pharmacy point of view from the US experience. Dr. Ugo, you have both you and Michelle. I'm going to throw questions, so between both of you, you decide who to take which. So I go. I would like you to share your journey in the retail compounding and why you felt it was important to add it to your pharmacy practice. That's one. And what types of patients and conditions benefit mostly from the compounding in the community setting. So that would be for Michelle. I would like to also to know what basic infrastructure and workflow are needed for a community pharmacy compounding to start, because a lot of us here would like to know, so that we're not looking forward to having a sophisticated infrastructure before we start. And then if you had to advise, what top three practical tips would you give Nigerian community pharmacy considering to go into compounding?
Well, number one, I just felt I was too educated to just do buying and selling. I wanted to run my own, pharmacy, community pharmacy, and I have a PhD in formulation, science. So I wasn't just going to have a traditional retail pharmacy without incorporating that compounding. So it kind of differentiated me from beginning, and it helped me to apply my advanced knowledge in my, just traditional pharmacy as well. Okay, so that was very, very important, for me. And so I just felt that there was a need to incorporate, compounding into it. Now, with all my knowledge, we did a lot of compounding in school here in University of Jos. Even after that, I went to teach compounding in school as a junior academic. Then before I went to do, my PhD. But before, with those knowledge, before I established compounding service in my pharmacy, I had to go for a training. It's just like a 2-day brush up training. In US, there are, different centers. BCCA is the Professional Compounding Center of America. They are the gold standard when it comes to compounding. They develop formulas. The academicians can, develop those formulas. They create databases and so on. Michelle had a training there as well. I never had a training there. I trained with the American Association of Apothecaries, So I needed to understand what happens in the system. So I went for that training, so it kind of opened my eyes, and they've made it so easy for us. It's like a plug and play. They will give you a list. If you want to start, you can start so small. Then as you have that platform, you can start expanding on the kind of services, you provide. So, and that's what we want to bring to, our homeland here, for people. First of all, the pharmacists, you have to be inspired. You have to be motivated. You don't have to be afraid of that, and we are available to guide, to provide, free services. So we're not here to look for government contract. We're not here to make money. It's just our passion. Some doctors come to Nigeria to do free medical services. So our group, what we want to do is to share, the experiences we have, the ideas we have, whatever problems, so that's where we are, so yeah. So motivation was just, I didn't want to be an ordinary pharmacist just dispensing. So I do that, and it elevates my profile in the community. Every patient who comes to the pharmacy respects my time. You want to compound? I said, compounding, I'm not just going to pull it. It's not already made. I'm not just going to pull it from the shelf and give to you. You have to give me 24 hours or 48 hours. And they will say, yes, sir. But when I was working in the retail store like Walmart and Kroger, if their medications are not ready in 5 minutes, I get insulted and so on. But running my own pharmacy, they respect that. And, it's very, very important to me.
Yeah, for Michelle, what type of patients or conditions benefits most from the compounding in the community setting? And what basic infrastructure, workflow are needed?
About who benefits most from compounds. The answer is really tricky because everyone can benefit from compounds at all different points in your life. The difference is it changes what you need. So I talked about earlier about how you have infants that have unusual circumstances. Maybe you have a baby that's born with a heart condition and they need really small amounts of heart medication. Or you've got an older child who has attention issues and can't sleep. Um, we do a lot of clonidine compounds. The parents of these patients call us lifesavers because we save their sanity. The children that can't sleep at night, and the parents' health suffers as well because of that. Um, Kids that have GI issues, we do a lot of omeprazole compounds. Um, and of course, as you get older, you might not need that because you've got your basic medications, but there might be specialized meds that you might want. For example, if you have, again, certain conditions, allergies, so you want those specialized meds. You've got the topicals, the creams, if you've got skin conditions. There are drops that you can put in your hair to help with hair growth. And then when you get to that geriatric stage, you was saying earlier about the wound care, you'd be surprised like how many people are affected by that. As you get older, your body doesn't heal the way it used to. Maybe you have conditions like diabetes, and you have wounds in your extremities that just don't heal. My dad has diabetes. He had a wound in his leg. It took 6 months to heal. If I had done that same might have taken me, a week. And then if it fits, it gets worse and worse. And you can actually compound specialized topicals that keep that wound in an ideal condition to help with that healing, even in those conditions, even in those situations when healing is difficult, like for example, in diabetes. So at any stage, you can benefit from the compounds. It differs based on what you need at that stage.
Dr. Udo, can you please quickly give us three top practical tips that one considering to go into compounding can use to be successful? Three tips to be successful. Three tips to go into compounding.
I think first of all, you have to be, you have to conquer that fear. It's not that complicated. One can always, get help. For the retail side, you have to make sure there is a space for that. Space really matters. And we've been advised, basically when we design our pharmacy, when you create your small laboratory, you make sure you put, a glass window, a see-through window, so that when a patient walks into your pharmacy, he sees somebody in that compounding, well-dressed. It kind of elevates trust. It's very, very important. So you hardly see any compounding pharmacy without that open window. It's like people queue up, here to buy bread from bakers, so they see you making it, so it's very, very important. So that's one important thing, your space, and you have to make sure your APIs are, of good quality sourcing. In the US, for example, the FDA regulates all those APIs, and they want the compounding pharmacies to get their products from FDA approved facilities. So you don't go to Onitsha Headbridge to buy any product or Hitomota. So those are the challenges we know, and somehow we can always come up with solutions, to them. And most importantly, you have to decide on which part of compounding you have to do. You don't have to just do everything. You can create a niche for yourself. I just want to focus on topicals, and you now relate with the dermatologist, or you can now say you want to deal with hormone replacement therapy, and you focus on women and some men as well. Or you can go into veterinary, compounding. That is very strong in South Africa. So you just take it simple. Personally, there are different categories of compounding. There is, non-hazardous compounding, hazardous compounding, non-sterile, sterile. I don't dabble with sterile because I know it's quite complicated, So I just do my, non-sterile, and I have enough patients, I turn some people away, to really, survive. I know some people have said, oh, there is no money in compounding, there is no marketing, or how would they get the prescriptions? I tell them basically when a pharmaceutical company develops a new product, how do the doctors know about that? They send out med reps to the doctors to, let them know. They organize seminars, they organize workshops and let them know. So when you develop, if you start offering compounding services, you have to let the words out. You let the doctors know that this is what you are doing. Your patients will start, letting other people know. And before you know it, you start simple, you build up. And most importantly, you have to also document that. So it's not a new thing. It's quite simple. The resources are there, whether it's in South Africa, America, they all adopt the USP standard, guidelines. Our hope is that, our pharmacy council will be able to develop a more national, guideline for compounding that covers the hospitals and the retail pharmacy as well. And that's a way we can, really move forward.
Beautiful, beautiful, so beautiful. Oh, beautiful, so beautiful. Life is so beautiful. Yes, how can? Yes. The world is beautiful. I'm a perfect example. Everything is on you. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. So beautiful. Now I'm so joyful.
Finally, we're going to have a raffle. We have 3 books. We covered those books, the Compounding Bible. I reached out to the American Pharmacists Association in the US that we are doing this, we are promoting this, and they decided to give us 3 complimentary textbooks on compounding to give out at this conference. Right. So you have made effort, you have made sacrifices, to come. So one person or 3 people are going to have these copies. And we're going to give that privilege of selecting the winners. Our Honorable Registrar, BCN Registrar, is going to draw the first draw. The Honorable Registrar of South African Pharmacy Council is going to draw the second one. So those of you who have your card, they're going to, select if you win. This, when you convert it Naira rates, depending on where you buy it, whether you buy it from the US or you buy it from the UK, the value is between 300,000 Naira to 500,000 Naira. So you stand to win this one right now. Okay, so we have those 3 copies. If you're in the hall, you have to be in the hall. So if we draw the person is not in the hall, we take a second draw. All right, so let's have those books. Yeah, we are ready. So we have those numbers here. So the registrar is going to take the first one. Yeah, take the first one. Don't look inside, sir. Don't look inside. Just dip your hand and pick. Who is number 23? Let the registrar come and join me. Let's make a presentation. All right. So we're going to send this picture to APHA, yours. Yeah. All right. Cool.
Because my life is so incredible. Everything around me is so peaceful. Hard times will come, but I will stay hopeful. Those days, I was never.
All right. Honorable Registrar from South Africa. Number 41. Number 41. Number 41 going. Number 41 going. 41 gone. All right. Take another one. Number 8. Let's see that number 8. Let's see that. Congratulations. This one is going to Ghana, but we're going to talk Ghanaian. Okay.
The mistakes I made are my breakthrough. Now I realize the world is so beautiful, so wonderful, so peaceful. Never knew.
Professor Nato, please. You have that privilege. Okay, who is this one? Number 46. 46.
Things could be so helpful. I learned to the hard way, the only way. Now I'm a big artist for Nigeria. FIFA.
Thing basically is that most of the people who have come here, we see them as people who have passion for it. They made the sacrifice, so we want to get them into a group. You know, we'll be able to provide them information, resources. If they want to start their own compounding pharmacies, we want to help them with that, and it's going to be free because we want to see it, happen. And at the same time, people who came from Ghana, we want to come, together with the South Africans and the Moroccans and have what we call a national or international conferences every year or every 2 years in compounding.
That register of South Africa for Pharmacy Council this year, and they only told us the experiences and what he's doing. I'm also happier that the Pharmacy Council of Nigeria registrar is also here with his team. He's here with 6 directors because he's ready to run with this vision. NAFDAC is also here. What I want to advise them is to quickly draw out a policy framework for compounding, so that what happened to us in online pharmacy will not happen to us. Online pharmacy, there was no regulation for online pharmacy. But when COVID came, people ran into online pharmacy. Everyone started doing online pharmacy without regulation. And PCN was forced to quickly get a policy for online pharmacy. So if we are not careful, the same thing will happen to us in this compounding. So I want to advise regulators to quickly develop a framework for regulating online compounding so that we will not be caught unawares, and so that our regulators will not go ahead of us and start doing whatever they like.
To what came out from the Governing Council decision of July 9, 2020. Fast forward to the information gathering, or you can call it assessment, of the status of compounding, which was done by the Registrar of the Pharmacy Council of Nigeria, precisely in November 2024, reaching to all the commissioners of health, all the CMDs, all the MDs of federal tertiary health institutions. We copy all the executive directors of health management board. And like I said, less than exactly 4 weeks ago, we have engaged, of course we engaged earlier with the national coordinator on unlocking the pharmaceutical healthcare value chain to intimate and sought his collaboration, which of course was positively disposed to, and which necessitated us giving him a comprehensive concept note of partnership, of collaboration, and this is one of the items. But even before then, like I did say, in the quest to travel on this path, we are also mindful of partnership, and we got partnership, a good one, in USP. United States Pharmacopoeia that supported us even in developing a concept way back in 2025. So what is happening now is like helping to crystallize or facilitate the journey we're already traveling on. And what this means is, like we have put it out, and other speakers have also spoken, is indeed going to help the Nigerian healthcare system, the Nigerian healthcare value chain. It will improve access to medicine. It will also reduce the cost of medicines. And certainly, it will also bring to fore the expertise that pharmacists have with respect to preparation of individualized medicines, with respect to making extemporaneous preparations, with respect to using their expertise to gather materials and resources that will help deliver medications appropriately to patients.
Appealing to all the policymakers to commit to this, because we can't go far without them. Luckily, the ones here today are already being positive, so we're sure that they'll do something.
The advice I have for stakeholders is more of collaboration and having the interest of the Nigerian populace at heart. So it's just a tripartite thing: the regulator, the pharmacist, the prescriber, and then the regulators, the pharmacist, the prescriber, and then that are the key stakeholders. So once the awareness is created to the doctors that we can do this, so that it's not just prescribing all one size fits all medication, so that it can be personalized in cases where it is necessary for the patient to be able to get the maximal benefit and minimal side effects and toxicity of whatever substance the patient needs. So the advice is just collaboration and then working together to achieve the goal, which is to ensure that our patients are healthier.
Policies, there are guidelines, a lot of things are available in this country. I remember in 2021, the Federal Ministry of Health, through the Director of Hospital Services, actually sent a circular to all federal tertiary institutions that they should all commence immediately, compounding in their various FHI. The circular is still there. But as I speak, it's only a few institutions that have been doing compounding before that still continue to compound. But the other area is that policies are promulgated, but there is no monitoring. So what I just want to say to the policymakers is that they should not only make policies, they should also ensure that the policies are monitored. Those that are supposed to implement it actually implement it. It's to the betterment of the patient.
We want to say God bless them, and then we want to say that they should have a safe journey, and that we will need more of that. And whatever training, resources, and other things they've even told us that they are going to make it available for free. It's laudable, and we appreciate that very much, and looking forward to getting these things done beyond the talking.
It's not going to be a yearly service. It's going to maybe like every 2 years. We're going to be doing it every 2 years. Right. But it's going to move from Nigeria to Ghana to South Africa, to Morocco. That's our goal, basically.
There comes a time when we heed a certain call.